Hi, Emily. My name is Emily. I'm a registered nurse here at Illini Rural Health Clinic. I'm just going to wash my hands for your safety. I am going to be doing a head-to-toe assessment today on you to check every body's system and make sure everything is working properly. It looks like you're dressed well, and it looks like you are pretty clean, like you bathe regularly. Is that correct?
Yep.
Okay. Can you tell me your full name?
That's Emily Hill.
Okay. What is today's date?
Today is July 18th of 2018.
Perfect. And do you know where you are right now?
I am at Illini Rural Health Clinic.
And what are we doing right now?
We are doing a checkup, just a physical exam.
That's exactly right. Are you having any problems with your mood, any depression or anxiety, any issues with behavior at all?
Nope, no problems at all.
Okay, perfect. So I am going to be touching you throughout the exam. I will make sure and wear gloves if I'm doing anything with any type of mucous membrane, but for the most part I won't. I wash my hands, so my hands are nice and clean. Are you having any pain today?
None.
None? Okay. Now if you were to have pain, what would be a comfortable pain goal for you?
4.
Okay, perfect. I'll mark that down. I am going to go ahead and start by feeling a pulse. And I'm going to count that out. All right, so you had 20 beats in 15 seconds. So your pulse is 80 beats a minute, radial. All right. I'm going to start by just kind of touching your head here, making sure there's no abnormalities, any bumps, and that feels all good. I don't feel any bumps on your head. Your sinuses don't feel swollen at all, and I don't feel any swollen lymph nodes. Do you have any problems with your ears at all? Any drainage from your ears?
Nope, none.
None? Okay. I'm just going to take a look in the external canal to make sure there's no drainage, and I see none. I see no breakdown around the outside of the ear. No issue there. No drainage from this ear either. No breakdown around the ear. The face is symmetrical. I don't see any swelling anywhere in the face. I don't see any abnormalities in your skin. Can I look in your nares real quick? I don't see any drainage or redness. That looks good. I will have to do an eye test as well to make sure that your eye muscles and nerves are all working properly. So the first thing I'm going to do is have you look straight ahead, and I'm going to shine a light in your eye, and I'm going to watch for reaction of your pupils, okay?
Okay.
So they started at about a 3 and they went down to about a 2, it looks like. And they both constrict equally. Now I'm going to have you watch my finger, and I'm going to go in towards your nose. Just follow my finger. And the pupils constrict there also. So they started at a 3 and they reduced to a 2. Okay, so I'm going to have you open and close your jaw and move it side to side. All right, I don't feel any abnormal feeling or any popping or cracking there. Do you have any pain when you open or close your mouth?
Nope.
Nope. Okay. We did your eyes, it looks like. I'm going to do your 6 fields of vision, so I want you to just follow my finger wherever it goes. Okay, and that was normal. There was no issues with an eye lagging or not going the correct direction. I'm going to look in your mouth now, check your throat. All right, can you lift your tongue? All right, your teeth look good. Do you go to the dentist regularly?
Yep.
Okay, good. Any problems with taste, swallowing, or smell?
Nope.
No? Okay, good. It doesn't look like your neck has any bulging or swelling anywhere. Your trachea is nice and midline all the way down. I didn't feel any swollen lymph nodes at all. We're going to move down to your arms now. Do you have any problems with range of motion, moving your arms at all? Okay. It looks like everything is Good and pink, not really dry, but you don't look like you have dry skin, and it looks like you're well hydrated. I am going to check for skin turgor. It looks like your skin is well hydrated. It does push back, pop back to where it's supposed to quickly. Your capillary refill is good. It turns right back from the blanched color to pink. So we are good with that. We did your pulse already. Man, I'm ahead of myself. All right, so we're going to test your motor skills. I want you to touch your nose and then touch my finger. Other hand. Okay. And then I want you with both hands, you don't have to do it at the same time, just touch each fingertip to thumb tip. Perfect. So your motor skills are intact there for your fine motor. I do want you to grip my hands. I want you to push my hands away. I want you to pull my hands back. Okay, perfect. All right, your chest looks like a good 2 to 1. It doesn't look like it's too deep in comparison to the width. I am going to listen to your heart sounds and then get your apical pulse, okay?
Okay.
So first I'm going to listen to the aortic valve, then the pulmonic, Erb's point, the tricuspid, and the mitral. Then I'm going to do the same with the bell to listen for any murmurs. Everything sounds good. I am going to get your pulse real quick here. Well, maybe. "21 for the pulse of for your apical pulse in 15 seconds. So that's going to be 84. So that makes a pulse deficit of 4 beats per minute. So that just means the pulse at your heart, by the time it gets out to your periphery, there's a loss of 4 beats essentially, which is normal. All right, so I'm going to listen to your heart. Not your heart, your lungs. Now listen posteriorly and anteriorly. Deep breath in for me and out. Okay, I'll do the same on the front. Lung sounds good. I am going to percuss the posterior lung field. So I'm going to put my hands on you and I'm going to tap. It might feel a little funny. And I'm listening for resonance there, and it sounds good. I'm going to lay you back just a little bit. We're going to do the abdominal assessment. I will not make you lift up your shirt or anything like that. The abdomen looks nice and flat. No abnormal appearance at all. I am going to listen to your abdominal sounds. And I heard 3 gurgles in 15 seconds there. Same there. All right, so I heard 3 gurgles in each quadrant of the abdomen in 15 seconds, which is normal for intestinal sounds. Do you have any problems with your bowels at all? Any constipation or diarrhea?
Nope.
Do you have daily bowel movements?
Yep.
Yes. Okay, and are those normal?
Yep.
Okay. Perfect. I'm gonna palpate your abdomen, okay? So I'm just gonna press lightly. Any pain or discomfort with that?
No.
I'm gonna go a little bit deeper this time. Let me know if you have any pain with that. I don't feel anything abnormal. I don't feel any kind of mass or distension at all. And I'm going to do percussion on here as well. And it has a nice tympanic sound to it. I'm going to percuss your liver. So what I'm going to do is I'm going to do the percussion. I'm going to start below the umbilicus here at the midclavicular line. I'm going to do the percussion up until I move from tympany to a dullness. And then I'm going to do the same I'm going to move from up down, and when I move from a resonance to a dullness, then I'm going to know that's the liver. We'll mark that out, and then we can measure it and determine your liver size. All right, so right here at this white heart, all right. Right there. So we will measure that out real quick. If I was prepared. And that is about 6 centimeters, which is normal. 6 to 12 is the normal length on that. Any problems with urination? I'm going to go ahead and stitch it up.
Nope, none at all.
No, so no burning or pain with urination, no frequency.
Nope.
Okay. Lower extremities here, I'm just going to take a look. I don't see any swelling. It looks like they're nice and warm. I'm not feeling any dry skin at all.
Nope.
Okay, perfect. I am going to slide your shoes off real quick here. And we're just going to do some capillary refill testing on your toes, which we have nail polish on, but that's okay. It looks good. I'm going to feel your pedal pulses. Those are good, nice and normal at 2. Your posterior tibial pulses are nice at 2+ on strength. And then your popliteal, they're a little harder to feel. But they're a good 1 to 2+, I would say. I'm going to do a few motor skills with you on that. So I just need you to run the heel of one foot down the shin of the other foot. Okay, and switch. Perfect. That just shows me that you have good control of those legs. And then we are going to do kind of the same skills as we did with the hands, but I want you to pull back and push forward. That's good and strong. 5 out of 5 on those. We need to discuss safety in the room. In here, there's not really too much. I mean, we're not in a hospital setting, so there's no call lights to be left with you or anything like that. The bed is in the low position. I'm not really too worried that you're gonna fall. But I appreciate you letting me see you today, and everything looks normal, so I don't have any concerns.
Thank you.
Thank you.